Good morning, everyone. Thank you for being here with us this morning. As usual, I'm joined by Dr. Kathleen Toomey, our Commissioner of the Department of Public Health, Commissioner Frank Berry of the Department of Community Health, and the First Lady's here with us as well this morning. As you have all heard me say at the beginning of the COVID-19 pandemic, this fight is about protecting lives, but also livelihoods. And for today's COVID-19 update, I'd like to start by sharing the great progress Georgia is making in protecting the lives of our citizens from this virus. First, our new cases reported are down 64% from our peak on July 24th. And according to the Wall Street Journal and Johns Hopkins University, Georgia is now 34th in new cases reported per 100,000 residents. Currently, our confirmed hospitalizations for COVID patients stands at 1,287. That's down 60% from our peak. COVID positive patients are now only 8.8% of our total people in Georgia hospitals, which is great news. Our two-week average of percent positive tests now stands at 5.9% statewide. On August 7th, 2 months ago, it was double that at 11.9%. So we've made great progress in that important metric. Cobb, Fulton, and DeKalb counties are now all under 4% positive for the two-week test positivity rate. When it comes to long-term care facilities and nursing homes, the state of Georgia has spared no expense, as you well know. We've sent supplies, provided testing materials, deployed infection control teams, and obviously been shipping out a lot of critical PPE supplies. As of September 15th, 172 of our nursing homes were in the red zone, meaning that their county had a percent positive over 10%. Today, that number is 49 nursing homes. That is a 71% decrease in the last 3 weeks. The number of nursing homes in the green zone with less than 5% positive in their county went from 19 homes to 69 facilities as of today. That is a 263% increase in nursing homes that are now in the green zone for test positivity in their county. And last week, as you know, we announced a $78 million in reimbursement funds to nursing homes to ensure they are able to meet the federal testing requirements, in addition to another $35 million in continued staffing assistance to these facilities through the end of 2020. We've been able to accomplish these significant improvements because Georgians have bought into what Dr. Toomey and I have asked them to do. And we're very appreciative of that. We said it on fly-arounds, we've said it standing outside hospitals, we've done it here at the Capitol, at the airport, and in communities all across our state. And we said that we needed Georgians to be part of the solution and not part of the problem. And I'm very thankful and very proud of the fact that Georgians have stepped up to the plate and have done the right thing. The key is for us now to keep doing this. We cannot take our foot off the gas. Despite what some in the media have chosen to ignore, we've been able to keep businesses open. Most kids have been able to return to schools, and people have been able to go about their lives in a smart, responsible way. But that is only sustainable if we continue to do our part moving forward. That's why Dr. Toomey and I rolled out 4 things for fall. Wear a mask, wash your distance, wash your hands, and follow the guidance Dr. Toomey and her team continue to put out there. If we all commit to doing the right thing, we need to move in the right direction in our fight against COVID-19. We've also made great progress in protecting livelihoods. Georgia's economy was firing on all cylinders before the pandemic. And it's a testament to the grit and determination of small business owners, entrepreneurs, and hardworking Georgians in every corner of our state that we are breaking economic records even during a pandemic. From July 1st to September 30th of this year, Georgia has announced the creation of over 10,000 jobs generating over $371 billion in investment on projects that the Georgia Department of Economic Development that has been working on. That is a 50% increase in new jobs created and an 85% increase in new investments compared to the same time a year ago. Our unemployment rate, thankfully, is below the national average. We've maintained our AAA bond rating. State revenues continue to be strong, and we were again named the #1 state for business for the 7th year in a row. We have worked hard to protect people and their paychecks, and yes, we can do both. In closing, I'd again like to thank everyone and ask them to do 3 things. First, join us today in continuing to do 4 things for fall. Wear a mask, wash your distance, wash your hands, and follow public health guidance. Number 2, get your flu shot early. Number 3, fill out your census form today by going to my2020census.gov. As we've mentioned previously, over the last many months, this is very important for Georgians to do this and do it today, if at all possible, at my2020census.gov. And with that, I'm going to now turn it over to Dr. Toomey, and she'll give you an update, and then I'll come back up for some questions. Thank you.
Thank you so much, Governor. Good to be here today. Really, Governor Kemp, I think, has become an epidemiologist because he's laid out all the issues as I would have done. I think the one thing I do want to emphasize is the importance not only of these, what I'm calling the 4 pillars of prevention, that the 4 things we can do for fall: wear a mask, socially distance, wash your hands, follow the guidance. But that 5th thing is get a flu shot. Flu, never more important to get a flu shot than this year. We realize that people sometimes don't think a flu shot is effective, or afraid to get it, or just don't bother. This is particularly important this year. We're trying to prevent twindemics of COVID plus influenza, which could be devastating. We don't know what the presence of influenza may do to a COVID infection. But at the same time, flu itself can be very deadly and can lead to hospitalizations that could fill up our hospitals and then not have capacity for COVID patients when and if that increase may occur. And so we're really saying this is an extremely important thing to do, actually as part of our COVID response. Get that flu shot. We have them available through public health as well as through many of our other community partners. You'll see that we're really emphasizing that children are particularly at risk, as well as the elderly and everybody else in between, because of the potential for spread, for example, in the workplace. And so we encourage everyone over 6 months of age to get a flu shot. And there's a special kind of senior flu vaccine that has more antigen to boost the immune system for seniors as well. And these are available throughout the state. Public health right now has to date over 307,000 doses of flu vaccine that we have already gotten out throughout the state to all of our health districts. And we'll get over 400,000 additional doses throughout the state, so statewide. Have these available at our health departments. The other thing that I'm really excited about is that almost all of our health departments are doing drive-through flu clinics. And this is particularly important this year because many people were thinking, I don't want to get a flu shot because I don't want to go into a clinic where I might be exposed to COVID. Well, the drive-through allows you to get that shot in your car. And for example, in the Dalton area alone, they did more than 1,700 flu vaccines in drive-throughs. And so they're doing hundreds a day in their drive-through clinics. So we're really very, very proud of the work that we're doing statewide to really focus on the flu vaccine this year is really one of the most important prevention efforts we can do as part of our comprehensive COVID response. I want to just also mention, because I think this has come up, just about our website and our reporting. We will be putting probable cases, this is not of flu, but now of COVID, on our website probably by next week. And these are antigen test positivity. I know this has come up. I've gotten many questions about this to our communications people. The probable cases are antigen positive cases. We respond to them as we do a PCR, or the kind of test that we do at our 188 SPOCs, or public health test sites throughout the state. So we are still continuing to test, still encouraging people to get tested at our sites, but are also recognizing that many people choose to go to an urgent care center or some other place where they can get these rapid antigen tests. You may have noticed that there's a little blip in percent positives that probably reflects some of the antigen tests being eventually added to our system. We haven't quite worked out that electronic transfer of those tests, and are working very closely with many of the urgent care centers, so that happens automatically and those tests get reported rather than requiring these clinics to enter those by hand. But you'll be seeing those added not as part of the total positives, but as a separate probable case category. So that's a coming attraction on our website as well. And so I just wanted to proactively mention that to you because it may come up. But again, to close, everyone from 6 months to 100 needs to get a flu shot, and please, this is the year to do it, and reach out to public health or many of our other private partners to do so. Thanks so much. Oh, and one other thing to note, when you do get your flu shot, take a picture and forward it to me. I think you have my email address, and we'll get you on our social media campaign. This is part of our social media campaign, and that would be really great to show everybody throughout the state actually getting their flu shot, and setting an example this year for this COVID prevention effort that we're doing. Thank you.
All right, well, thank you, Dr. Toomey, for that. And as I said earlier, we're glad to take any questions that you guys have. Obviously, Dr. Toomey's here, and also Commissioner Berry's here with us this morning.
Yeah. Governor, what kind of message or example does it send when you speak at events like last week's Faith and Freedom Gathering, where people are not social distancing and not wearing masks?
Well, I can tell you, if you were there, or even if you weren't, I was wearing a mask, continuing to try to set a good example and ask people to do what we're asking. But look, we've had political events, other issues, demonstrations, protests, where people have First Amendment rights. What we're trying to do is get people to be respectful, do the 4 things that we're asking them to do, and that's what we're going to continue to do.
Question for Dr. Toomey.
It's coming from heaven. Oh, okay.
Good to see you, Dr. Toomey. I just had a question. Could you describe the possible severity of a situation where there's a school that has quite a number of COVID cases and then a significant prevalence of the flu, if that happens?
I think that, like many other things, in this pandemic, we don't know. This is still new. This is the first time we've experienced COVID plus influenza, but we've had many years with flu increases in schools, where in some cases we had to close schools because so many teachers were ill or so many students were ill. And I think we're going to work and really encourage the school superintendents to continue to work closely with the local health directors to monitor that very, very closely. Right now, we are not seeing a lot of influenza activity, and even the COVID activity in our emergency rooms is still pretty flat. We want to stay on top of this. And you probably aren't aware that I have been having regular calls with the school superintendents and our health directors who work with me throughout the state, often call them several times a week just on a regular catch-up, but also to follow up on something like this. And so when that happens, we will ensure the safety of the students and the teachers and the staff. I mean, this is what we want to do, and we're learning as we go, and we're going to continue to follow CDC guidance as we move forward.
Let me just add too there, I just want to thank all of those in our schools, our teachers, administrators, the superintendents, local board members. I mean, they have done a great job. We knew when schools went back there would be issues that schools had to deal with. They've done that, and I think they've done a great job. I appreciate Dr. Toomey's constant communication, as well as the local health directors and the regional folks as well that have stayed in constant communication to make sure we're being consistent with the guidelines and working together on these issues. This is not something new to them. Obviously, COVID-19 is new to them, but dealing with viruses, whether it be a flu virus, a stomach virus, what have you. I mean, our educators and administrators have had to deal with this kind of thing before, and we'll continue to help them along the way and work with them. I'm hopeful if Georgians continue to do the things that we're asking, wear their masks, socially distance, be smart about gatherings, washing their hands, following the guidelines. I'm hopeful that we can have a reduced flu season this year, and that our COVID numbers will continue to hold their own or move in the direction of lower percent positives in the future. And that's what we're trying to do every day. But we also know as more kids come back, we've got some of our metro areas now that are coming back in. We're going to have issues that we have to deal with. This is a virus, and that's what we said early on. We know that people are going to get it. What we want to do is minimize it best we can to stop the spread. We did a lot of things early on to build up our hospital bed capacity so that we were prepared to continue to rebuild our economy during a time like this, and what we're going to be dealing with until we can get the vaccine distributed.
Governor, as of yesterday, Georgia remains on pace to record 10,000 deaths from COVID-19. With that considered, can we classify the state's response as a success?
Well, I think we've had many great successes, but make no mistake, this has been a tragic virus for those that have gotten it and have succumbed to it. And those individuals, families, and their local communities remain in my thoughts and prayers. And it's so, I talk to people just about every day about just the unknowns with this virus, how it negatively affects some and just hammers others. But I'd also refer back to the models that said we would have 20 to 30,000 deaths at the end of this summer. So I can tell you that what we work on every single day, is to prevent any death that we can, whether it's in our long-term care facilities and otherwise, and that's what we will continue to do during the course of this pandemic.
Governor, thanks for taking questions. So you point out the state has made a lot of progress since our peak we saw in July, but looking at statistics from our own Department of Public Health, that progress has really slowed down as of late. A report they put out yesterday says the 7-day average of new cases actually increased as of yesterday afternoon. Percent positivity has also increased slightly. So it's great to point out this progress.
Did you say increased slightly?
It's from
Okay.
DPH from 6.3% to 7% as of the 5th. So what do you make of this plateau we're seeing right now?
Well, as the members of the media always remind us, we have to look at this on 2-week cycles. So, cherry picking the worst figures that you can,
Governor,
like you've done in the past, I think is a little disingenuous to the public. I would encourage them to read Dr. Toomey's reports that she's putting out. I would encourage them to go to the website and get the numbers like I do every day on a multitude of things. Percent positive, number of cases, number of tests that we're given, where our hospitalizations are, what our R rate is. We were, first in R rate a few days ago. I think we're still in the top 5. So I would look at all the data, and you have to remember, we still are reopening our economy. We still have more kids going back to school. So for us to have a small bump in cases at a defined period of time, if you look at our 2-week average, I think we're still in great shape. But that's what we're doing every day, is we're focused on that and many other things. But it's interesting that some people will focus on only the negative and none of the positive, whether it's COVID news or economic news. And I can promise you, I'm going to continue to tell the full story. And if we start getting concerned about hospitalization numbers or a rise in cases, we'll figure out, why that is. If it's a specific area, if it's a specific outbreak, like we saw at one of our military bases. But to just paint that in a broad picture for our whole state, I think is not very telling to the members of the public.
So, Governor, this is a report from your Department of Public Health. I've had members of your staff ask me specifically to pay attention to these reports from the Department of Public Health.
Okay.
So should we not pay attention to their numbers?
I didn't say you didn't need to pay attention. I just said that people should look at all the numbers. I can promise you that we're paying attention. We're putting the data out there. So we're fully aware of what's going on. Dr. Toomey addressed that early, and if it becomes a concern, we'll start telling people that.
Can I say something real quick?
Yeah, sure.
No, I think that I actually addressed that in my opening remarks, that, as we see the antigen tests becoming part of our total positivity, I mean, you will be seeing a little bit of a blip. We expect that because people are getting antigen tests, and there's been a lag in getting them reported, and that to me is not surprising. I'm expecting to see that. I think the important take-home message from the governor and from me is that everybody has to continue to follow the prevention guidelines, to wear a mask, to social distance, that this virus hasn't disappeared. The numbers have gone down, but we still have to take these preventive measures until the time when we have a vaccine and can move forward. And testing is just one asset we have, but I think we may see some up and down due to the antigen tests, but I'm more concerned about being able to follow up very quickly, as Governor said, any hot spots and identify where there may be some focal increases and get on top of that right away, which we are doing and working in partnership with our local health departments.
Governor Kemp, good morning to you. Thank you for doing this. Archith with Nexstar. We're weeks away from the election. What is your message in terms of people getting out there to vote, early voting starting Monday, to keep poll workers, voters, everybody safe, given that this is going to be a very different election than we've seen in years past?
Well, I think people need to let their voice be heard. We got one of the greatest states in the country for access to the ballot, whether it's early voting, absentee voting, by mail, obviously in person. The ability for people to register before the deadline with, basically registering to vote 24 hours a day, 7 days a week on a mobile app on your phone and online. But we're just a state that, wants to make it easy to vote and hard to cheat, and we want to have secure, accessible, fair elections, and I believe that we'll have that in Georgia. I had the honor to work with a lot of hard-working local elections officials at the county level, as well as those board members that, as you know, is a bipartisan group of people, and I know they're working very hard to make sure that people have access, and they can do that, and I would encourage them to do so.
Thank you.
All right, thank you.